Are you color blind? Have you ever been told that something has different shades but they look the same? If so, then you could be color blind. Think of your eye as a camera. The front part of your eye has a lens. The work of this lens is to focus images on the inside of the back of your eye. This area is called the retina. The retina is covered with special nerve cells that contain pigments that react to light. Cones control your color vision. There are several kinds of pigments present in 3 types of cone cells. Some react to short wavelength light, others react to medium wavelength, and others react to higher wavelengths. Rods. This have only one kind of pigment. It reacts the same way to any light wavelength. Rods don't have anything to do with color vision. They are very sensitive to light. This allows us to see at night. When the cones have all the various pigments called photopigments, your eye sees all possible colors. If there is a problem with the pigments, then you might have a problem seeing colors the way you should. This is what is called color blindness. If it's only one pigment that is missing, you might have trouble with seeing certain colors. If you don't have any pigments in your cones, you will not see color at all. This is known as a chromatopsia, and it is rare. What causes color blindness? At times, genes inherited from parents cause faulty photopigments molecules that detect color in the cone-shaped cells or cones in your retina. Other causes of color blindness include optic nerve damage, physical or chemical damage to the eye, damage to parts of the brain that process color information, cataract, age. Types of color blindness. Red-green color blindness. This is when photopigments in your eye's red cones or green cones don't work properly or don't work at all. There are several types. Deuterianomaly. This is the most common form of color blindness and affects 5% of males. It is rare in females. This happens when the green cone photopigment doesn't work as it should. Yellow and green look more reddish. It's also hard to differentiate blue from violet. Protanomaly. This is when your red cone photopigment doesn't work as it should. Orange, red and yellow look greener and colors are less bright. It's usually mild and doesn't cause problems in daily life. It affects about 1% of males. Blue-yellow color blindness. This is when your blue cone photopigments are either missing or don't work correctly. It's the second most type and it affects males and females equally. Tritanomaly. Your blue cone cells work in only a limited way. Blue looks greener. It can be hard to tell pink from yellow and red. This is extremely rare. Tritanopia. This is also known as blue-yellow color blindness. You don't have blue cone cells. Blue looks green and yellow looks light gray or violet. It's extremely rare. Complete color blindness. This is also called monochromacy. In this case, you don't see any color at all and your vision may not be as clear. There are 2 types. Cone monochromacy. This happens when 2 of your 3 cone photopigments, red, green, blue, don't work. When only one type of cone works, it's hard to tell one color from another. If one of the faulty cones is blue, your vision may not be as sharp. You may be nearsighted and the eye movement uncontrollable. This condition is called nystagmus. Rod monochromacy. It is also called a chromatopsia. It is the most severe form of color blindness. This is when none of your cone cells have photopigments that work. The result is that the world appears to you as black, white and gray. If you notice a serious change in how you see color, visit an ophthalmologist. This is a doctor trained in eye care and vision. Your symptoms might be a warning sign of something more serious. The doctor will use colored tablets or diagrams to do the test. There is no cure for inherited color blindness, but if illness or eye disease is the cause, treatment may improve the color vision.